I have some thoughts, mainly from the evaluators' perspective, because I've been into this space for several years, working with the health department and health ministry on many occasions, looking at conducting research and also doing the evaluations. And from my perspective, the success for evidence uptake in policy programming is when there is that sufficient increased awareness of the issue among the policymakers or even the program managers. Not necessarily that every evidence needs to change the policy or modify the policy, as Dr. Kajal or Ranu has pointed out. But what it also means, the changes in beliefs or attitudes and the communication between the different stakeholders, between the researchers, the policymakers, the program implementers, and the funding organizations, or any other stakeholder who is well connected in understanding the issue. So is that those are the kind of steps that could be even classified as a success, and change in the practices or response action. And the most important outcome, and often that is seen as the something that funding organizations or the people in the advocacy implementing organization would like to see, is what has been changed as a written policy, or whether or not the bad policies and laws are prevented, and how is this program is modified significantly to make sure that it connects with the evidence. There are a couple of examples, quick examples, that I would like to share. In case of HIV/AIDS, as many of you may know, that in the early times of that HIV/AIDS epidemic, there was a whole lot of reporting that was happening in media. Mostly it was negative reporting, increasing the stigma and discrimination about the people who are involved in sex work, or about the people who are diagnosed HIV positive. So there was this whole effort of the media advocacy that has started, and started sensitizing the journalists, sensitizing the editors, and working with the other constituents at the local level who are actually reporting the news. And what was seen eventually is a significant change in that reporting, from the negative reporting on the HIV per se, to the more about the positive reporting, and being sensitive about the people who are diagnosed positive. And that and I was involved evaluating that advocacy, media advocacy initiative. And what we have seen was, there was this tracking of the newspaper articles, which actually happened since before the start of this media advocacy to whole period, and there was a clear pattern, so that it doesn't actually lead to any tangible outcome per se, but what it is actually leading to is that significant change in the practice and the pattern of reporting. That was a one typical example. And the other example is among the migrants, in case of the HIV/AIDS, where there's HIV prevention interventions only in the destination areas. And the research that was done has actually said that, if we want to really prevent HIV among the migrant households, we need to work in both destination and source areas. And that's how the corridor of intervention that came into existence at the National AIDS Control Organization. And the one thing that has worked in terms of the evidence uptake is that in that research, the researchers actually work with the policymakers directly, because policymakers has this the vision, as Dr. Kajal said, had the larger question that, how do I control the HIV in the source areas, the source states, for example, Bihar and Uttar Pradesh? What is what is the evidence that is suggesting? And there was no evidence to actually suggest some program implementation. So in summary, what I'm saying is, The key element is the relationship, the collaborative work between the researchers and the policymakers actually helps in helps in evidence uptake at that level. But whether is the success possible and measurable for all advocacy initiatives? Not always, actually, because it all depends on the type of issue, the type of intervention, the complexity, the political and cultural context. And as Dr. Kajal mentioned, there are several other parameters to it, including the budget availability or the resources availability or many other factors that are involved. The typical example is the family planning, and we have the family planning programs for several decades, and we are making a significant progress in terms of the family planning program. But what needs to be done is one of the examples that all have been working together with Mamta, C3, and several other organizations is to demonstrate that the family planning initiation in the early years of marriage actually helps the couples to decide when to have children, how many to have children, and how much to space children. There is that what we see in that pattern is there is that realization on the issue, but how to operationalize it, what action that needs to be taken, what outcomes can we achieve, is some significant work that's needed, and that's where is the complexity that exists. And a similar example for adolescent health, where I'm personally involved in doing that. And the one of the learnings that we had on the principles in evaluation of advocacy interventions per se is the alignment among stakeholders. The stakeholders, when I say the evaluators, the funders, the policymakers, the program managers on the type of outcomes. Whether the outcome we want to see is going to be the large transformational change, or is it a slow and incremental change? And that's how one has to define what outcome can be achieved from that process. And many times the advocacy evaluations do not capture the processes, because the process is going to be key critical thing. There is this, while we all think that the evidence is generated and presented and has been referred in the program or policy, but what is clear is that the socialization that goes behind behind that evidence presentation is also a key important factor in the uptake. And the defining the small wins, whether the change in attitudes, beliefs, or awareness, and outlining the interim outcomes. And outcomes, many times for the advocacy initiatives, the aspirational outcomes are aspirational. No harm in having the aspirational goals for the initiatives, but are they realistic? And how much can one advocacy initiative achieve? And then there is a big question about the contribution versus attribution. Everyone wants to see that how advocacy, research advocacy, or the program advocacy actually going to cause an impact in change in the policy. But for all these social and health and developmental interventions, we are more, there are several stakeholders involved, and there the contribution comes as a key factor rather than the attribution, because it's not a medical intervention where you conduct research on one pill and take that pill to administer to different populations. This slide is just a kind of a repetition of what I said. And finally, I wanted to end by saying that the advocacy interventions are much more complex and fluid. And measuring the cause and effect is not only difficult in the complex settings, but it is important to take into consideration several dimensions, and there are several innovative methodologies to conduct the evaluation of advocacy initiatives. Thank you.